For those new to Encoda, we want to share that our organization has a set of quality standards grouped around 4 categories. We'll be highlighting these throughout the year. And to start, we have the patient-centered quality standard to be presented by Jim Schwartz out of Texas Oncology.
Thank you all for calling in this afternoon or this morning, wherever you are. Again, you got a slide there for me, Josh? There we go.
Yeah.
Encoda has quality standards that have been developed and have been in place, and we will continue to look at. They're available on the website. You can see there at the bottom, going to encoda.org and going to the quality standards. During this and the next 3 meetings, we're going to be going over these. There are 4 big sections, and this is the patient-centered quality standard. Next month, we'll have the foundational elements. After that, the health information technology, and the 4th one is positive quality interventions. And we'll be going over those during this and the next 3 meetings. Encoda is working with ASCO. They've asked that we allow our standards to be incorporated into their COPI process. So that's being worked on. So I think it's very important that all members of Encoda be familiar with these quality standards and be working at your practices to implement those aspects that will help you bring your quality and the way you treat patients to a higher standard. Let me briefly go through this. We've got some time. I thought we were running late, and I'm not just going to read this slide to you. Let me just tell you, the patient-centered quality standard, it's a 4-page document. There are sections in here for patient relationships, patient compliance, adherence and persistence, patient education, patient safety, cost avoidance interventions and documentation, benefits investigation, medication disposal, and lastly, patient satisfaction. All of these are very important. There are specific guidelines under each one of those to help you provide better care to your patients. It's not like the usual accreditation standards, how quickly do you answer the phone, things like that, but it does encourage helping the patients adhere more closely to their therapy, identifying side effects, documenting fully along with all the other healthcare professionals in the EMR. Of course, then just highlight a couple of these on here. It's very important that the patient have direct access to the team and not just the pharmacy or dispensing area, but the nurses, the APPs, the physicians. So every patient is getting a quality encounter and with the oral chemotherapy that they're taking. Anytime a drug is being filled or refilled, reviewing the EMR for clinically relevant information is imperative, and that's what sets us apart from other providers of oncology oral drugs, is that we have access to the EMR, we have access to the rest of the team, and those standards are all written in. Also, we do our best to get benefits taken care of for the patient and get any patient assistance, so financial toxicity is not an issue. We all know what these drugs cost, but helping the patients out so that's not a problem for them and they can focus on how the drug is affecting them, taking care of side effects. And then lastly, the standards for ensuring that they have a way of disposing the medications or expired drugs upon completion of therapy. These are potentially toxic drugs. Every state has their own standards and what they'll allow in terms of who can take the drug back and expire it. But everybody needs to look at the standards, that and all of them, like I said, and they will help you improve the practice, improve your ability to provide oral chemotherapy, make you a more valuable member of the healthcare team. And of course you all are, but I encourage you to look at these standards, be familiar with them. We probably will put together a group to look at these standards. They have been there a while. They're all very relevant, but there may be some things that we can spruce up. But like I said, during the next 3 months, the monthly calls, we'll be talking about these other 3 quality standards, and we look forward to talking to you about them then. Any questions about these?
Thank you, Jim. Any questions?